Good day, everyone. I want to welcome you to the 27th episode of Insight Webinar. Insight Webinar is a series hosted by eHealth Africa, and this series brings together public health professionals to discuss critical issues and explore ways to enhance healthcare delivery. My name is Tijesu Ojumu, and I'll be your moderator for today's conversation. So let's get started. Just in case, you know one or two people who should be on this call, professionals in this field who you think this conversation will be of huge benefit to, please share the link of this webinar to them and encourage them to join us as we dive into the meat of today's meeting. So the 20th of November 2024 was the World Geographic Information Systems Day under the theme Mapping Minds and Shaping the World. This theme emphasizes that by connecting maps, applications, data, and people, GIS has the potential to support countries, partners, to make informed public health decisions faster and to extend the reach of geospatial information across organizations. And for us at eHealth Africa, GIS has indeed transformed how we reach underserved communities with public healthcare services. On this note, today's webinar will discuss the power of GIS tools in public health interventions, and we will explore strategies to optimize the impact of GIS to improve public healthcare delivery. Once again, for those who might be new to this field, maybe you've been hearing about GIS, you've seen it, in different places. It simply means Geographical Information System. So today's panelists are leaders in the Geographic Information System sector, and they have consistently deployed GIS tools for public health intervention for at least a decade. And so in no particular order, I'm going to introduce them. So when I introduce you, a panelist, and I call your name, please unmute your mics and say hello to the audience. All right, so the first person I would introduce is the data team lead for the National Emergency Operations Center in Nigeria, and he's none other than Mr. Dahiru Hassan Mohammed. Mr. Dahiru has 13 years experience in public health and extensive knowledge of national data systems and best available data sources in Nigeria. He has been using Geographic Information Systems, as GIS, in the last 6 years, while also coordinating GIS-related activities at both national and subnational level. Also, Dahiru is a renowned, field person, as he has consistently supervised and led teams in the field for vaccination campaigns and other public health interventions. Mr. Dahiru, can you say hello to the audience?
Thank you, and good afternoon. Thank you, Ojumo, for this wonderful insights.
All right, thank you. Yeah, thank you very much. Okay, so up next among our panelists he's a GIS analyst with eHealth Africa, and he goes by the name Oluwatosin Ilesomi. Mr. Oluwatosin is a seasoned GIS and data analyst with over 15 years of expertise in leveraging special technologies to deliver data-driven solutions. He's proficient in advanced GIS tools like ArcGIS, QGIS, as well as remote sensing softwares. He excels in transforming complex data sets into actionable insights. His skill set includes data visualization with Tableau, Power BI, Looker Studio, programming in Python and R for analytics, database management with SQL. He has a proven track record in project management, technical support, and capacity building initiatives. His work extends to designing solutions for displaced populations and enhancing health service coverage through spatial data applications. Mr. Oluwatosin, please unmute your mic and say hello to everyone.
Thank you, Tijesu. I'm glad to be here. Thank you, everyone. Yeah.
Thank you so much. All right, and so last on our list, but not the least, is none other than the Chief Executive Officer of Grade 3, Mr. Mark Levy. Mark is the Chief Executive Officer of Grade 3, where he leads efforts to create innovative, practical solutions to the spatial data needs of health delivery communities in sub-Saharan Africa. Grade 3's focus is currently on immunization and malaria prevention in the Democratic Republic of Congo and Nigeria. After working for 30 years in university positions, Mark launched Grade 3 as an independent non-profit corporation in 2022. He has authored or co-authored over 50 peer-reviewed publications and has been a principal investigator on over 80 funded projects. Hello, Mark Levy.
Hello, I'm very happy to be here with you all today. Thank you.
Thank you very much. I'm really excited about this conversation, and I can't wait, for us to get in and, to glean from your experience and the insights that you have to share. But just before we do that, we will go on a short break. We'll watch a short video put together by eHealth Africa, and it's around our deployment of geospatial tracking systems for vaccination campaigns. So don't go anywhere. Share the link of this webinar to colleagues and friends who should be on this call, and remind them that we have started. And let's anticipate a swell conversation. So IT, please help us and then, give us the video. Thank you.
This is a mobile app that we use to track vaccinators from their takeoff points to their points of activity.
With this, we know our longitude and we know our latitude, and this will help us to know the actual name of the rural settlement.
Anyone that is missed is usually red, and the ones that are rich are usually green.
As of today, Sokoto North is on 99%.
All right. Welcome back. Welcome back. Okay, so we're going to jump into the questions for today. Please, as we, progress in the conversation, people will have questions that they want to put, to our panelists. So please use the chat box, put in your questions, and hopefully we get to take your questions and you get to receive answers from our expert panelists here. So the first question goes to Mr. Tosin. Can you please tell us more about your current role and how your organization deploys GIS tools, especially for public health interventions?
Thank you, Tijesu. Currently, I'm the Associate Manager GIS for eHealth Africa. So over the years, eHealth have been involved in helping polio program to achieve success. One of those ways we achieve success is by helping to show all the locations of settlements, because what we are trying to do is to ensure that no children is missed for vaccination. And children are located in settlements. So of course, we need to map all the settlements. So over the years, we've been able to map hundreds of thousands of settlements. That is, people go to the field to capture geocoordinates and the other attributes of settlements. And also, we're able to track immunization activities. And we're able to track them to know how long those settlements have been reached, how often those settlements were reached. We're also able to know what portion of settlements are missed and what portion are visited. With that, we're able to determine how many children have been missed. We're able to help in micro-planning. So a lot of this activity is hinged on the fact that we're able to map settlements so that no settlement is missed. If no settlement is missed, we know that no children is going to be missed. And of course, if no child is missed, if every child is vaccinated, then of course, you ensure that that means the virus cannot spread. That is, the polio virus will not spread. So yes, the idea is to cover every location, cover all the children, so that the virus will stop spreading. And before you can be sure that virus will not spread, you need to know where the children are. You need to be able to track the activities of vaccinators. So that is what we've been doing. And currently what we do from the National Agency for Health Africa is to help, first of all, in the micro planning, preparing for campaigns. We do a kind of micro planning to create areas for where they are going to track. There's one they call target areas. We create those areas, and those areas are uploaded on the platform called Geospatial Tracking System. And that platform helps with the phones that was shown on the video. Those phones collect those tracks every 2 minutes. Then those tracks are downloaded, and we check that, and to be able to see settlements that have missed, settlements that are covered. And when settlement is missed during the campaign, we're able to plan it for subsequent days. At the end of the day, if settlements are not visited, we track them over time and say, okay, these are the number of settlements that have never been reached. These are the number of children that have been missed. And the program look for a kind of intervention to reach those places that have been missed. So this activity, this process itself is done with the geospatial analysis with different kind of tools that we have in-house. And that tool has helped to ensure good coverage of the vaccination activity across the northern Nigeria. And of course, we're trying to extend to other locations, but it has actually helped to ensure that there's a good coverage, and we are able to see the quality of reach, the quality, the time spent by vaccinators in each of those locations. So it has actually helped the program and also direct the program to see places they should focus on, settlements they should focus on, and to see children that have been missed over time. So this is what we do, and this is what I do. I lead some of these analyses and provide the information and the feedback and reports to the National Agency. Thank you.
Thank you very much, Mr. Tosin, for that extensive explanation of what you do and how eHealth Africa deploys GIS tool. I can't help but imagine how many people will be deprived of access to vaccines without us having systems to track places that have not yet been reached. Okay, so my next question goes to Mr. Mark Levy. What are the key connections between GIS and public health care, or you might say digital maps and public health care?
So the connections are very profound. As you all know, GIS was essentially born in the 19th century as a result of efforts to identify causes of cholera outbreaks in England. And so our whole discipline was really born out of these connections. The way I think of it is that there are abstract or theoretical connections between health workers and the people they serve. There are abstract or theoretical connections between government decision makers and who are deciding about where to allocate resources such as health facilities and the communities that need those resources. And what GIS digital maps let you do is make those theoretical connections very, very real and concrete. So if there happens to be a community that is left out of a service plan, you can see it right there on the map. If there happens to be a set of government decisions that leaves a part of an LGA or state lacking adequate health facilities, you can see it right there on the map. So it lets people be transparent and be held to account for the decisions and actions that they're taking. And it enables the communities to see whether or not they are being allocated the resources that they need to live healthy lives. Thank you.
All right, thank you very much. I totally agree with you. I think you're spot on. That's GIS allows to draw theoretical connections between people, healthcare workers, and the people that they respond to, the location where they reside, the government resources, and so much more. All right, so that brings me to this question for Mr. Dahiru. What inspired the need to deploy GIS, especially for vaccination campaigns? Mr. Mark Levy has spoken about theoretical connections. Now, from your perspective, what inspired the need to deploy GIS, especially for vaccination campaigns?
Thank you, Jesu. So basically, it has a lot to do with accountability and coverage. At the beginning of the, am I audible? At the beginning of the polio eras, you will send a team to go to a certain place to do vaccination, and something or somehow they will refuse to go there, or they will go there and just cover a certain portion of that area, and they will tell you that it has been covered. So we decided to start using, as Tosin mentioned, the GTS the tracking device, to see whether they went to where they're supposed to go and what's the quality of coverage in that area. Also, for the supervisors, we used to send supervisors to the field during campaigns to go and supervise the teams and give on-the-job mentoring on what have you. But some of the supervisors will be working by proxy. Maybe they are sent to a state A and you'll see them in state B. So we deployed use of ODK also, which get the coordinates of where you are, and you put it on the map, and you can easily identify who is where and what is happening where. So same thing with the vaccination teams. That's why up till now we are still using that, and it's yielding a lot of results. And not only for the polio campaign, but also we did that for the COVID campaign, the measles and the yellow fever, also non-polio campaigns. We used to deploy all this technology. Thank you.
All right, thank you very much, Dahiru. I think that was spot on. Accountability and transparency. So for those listening to us, he's just saying what inspired, the application of GIS for vaccination campaigns in Nigeria is the need for transparency and accountability. And you all will agree with me that if we're not transparent about the process, there is no way we can have accurate data to tell, what areas have been covered, what areas have been left out. It also speaks to the proper management of resources, deployed to meet vaccination targets. So it's great to hear that, GIS is being used to, provide solutions for, transparency and accountability needs. Thank you very much, Mr. Dahiru. All right, my next question goes to Mr. Mark Levy. As the Chief Executive Officer of Grid 3, your organization has supported African countries with tracking systems. So from your experience and expertise, at what stage do you think Nigeria is when it comes to the adoption of GIS tools and digital maps for public health campaigns? What stage do you think Nigeria is right now?
Yeah, it's a very exciting time to be working in this area in Nigeria. In many ways, Nigeria is defining the cutting edge on how to take advantage of spatial and digital technologies to improve healthcare. Many of the important innovations were actually invented in Nigeria. And there's a very deep pool of talent in this area. I believe eHealth is the largest employer of GIS experts in Africa, and that's a sign of the great set of capacities and activities that are underway in the country. At the same time, there's a lot still to be done. So I think across the board, the health communities are aware of the power They see the need to incorporate spatial technologies, but it's still fragmented. There are pockets of intensive adoption, and there are still large areas where it's only beginning to make inroads. Um, Even in the areas where there's intensive adoption, I think we're at a time now where there's enough internal experience and capabilities to take it to the next level. Um, that would be many things. I'll just draw attention to two. One is I think now's the right time to set very clear expectations about how microplans and other service plans refer to their service areas in terms of specific spaces on a map. And to organize the training and the supervision around those expectations. So if local health workers need training in order to be able to do this, then find a way to provide it, across the board, not just sometimes yes, sometimes no. Um, if a ward or LGA provides plans to a higher level and they're deficient in the way they refer to service areas spatially, then make them fix it. And if they need technical assistance to fix it, then have a way to provide that. So I think it's universally acknowledged and it's very deeply incorporated in many areas, but there's a need to do even more. Thank you.
Thank you very much, Mark, for sharing that perspective. And like Mark has rightly said, we are in a place in Nigeria where, I mean, we're not doing so bad, but there is always a space to do more, Thank you very much. All right, so if you're just joining us, you're welcome again to the 27th episode of Insights Webinar. Today we're discussing connecting communities to healthcare with digital mapping. And we have in the house Mark Levy, the Executive Director of Grade 3. We have Dahiru Mohammed, Data Team Lead for the National Emergency Operations Center. And we have Oluwatosin Lesomi, an Associate Manager, GIS eHealth Africa. So my next question is to you, Mr. Tosin. Can you provide examples of how digital maps have successfully improved healthcare delivery? Now, especially in underserved communities. Can you give us just a few examples, maybe one or two?
Yeah, thank you. Let me just mention like 3 examples. First of all, let me talk about an example of what we did in Borno. There was a time Nigeria had white polio virus, and a lot of attention focused on Borno. And we were deployed to Borno to provide support, data management and GIS support. So what we did in Borno was, one of the things we did in Borno is to regularly provide maps to show coverage every time. So there's what they call them, they do like advocacy visits to communities, and maps are always printed every time you go for either advocacy visit to the military that helps in vaccination there, or to community leaders. What we do with those maps is that we show settlements that have never been reached, settlements that have been reached, and the status of all the settlements. Of course, before that, we have mapped all the locations and mapped everywhere. But we now do a map to show where settlements, the status of each settlement, so that they can see where they are per time. And over time, we see reduction in the settlements. There's one we call the vaccination rich baseline. It was developed in Borno. If you look at vaccination rich baseline in 2016, and the current one we have in 2023, you see that it was completely red. Almost the whole of Borno was red. And that red is based on either security issue and vaccinators could not reach some places. But by the time you look at improvement over the years, you see how it has changed, how the polio was able to reach those places. Using those maps, they help them to understand and see the progress that's been made. So those maps are like digital maps that we produce. Of course, most times we print those maps, but you're able to see those improvements. If you go to Borno UC, see those maps printed in the wall of the UC there, and you see the improvement, how it has changed from red to green. So that almost the whole of Borno is almost green right now. So that is one of the things, and it helped them to drive attention to places that are red, so that interventions like community informants can be community informants are like locals that can access some places that even militaries could not access. So you need to drive the attention to those locations. Also, another use case for those digital maps is a GIS microplanning. GIS microplanning is like a bottom-up approach to ensure that every location is planned for and every child is reached. So what we do is that you create a platform where the maps are produced, ensuring that all the children in those settlements are reached. So there's a GIS microplanning, there's a platform there's one we use currently called it Planfield. And that is a way to ensure that every intervention for each of the interventions, you determine the number of teams to reach those locations and determine the number of days required to reach those settlements. And the map shows like the kind of catchment, the team catchment for those areas. And by the time you follow those, it actually helps you to efficiently plan every campaign. You're able to efficiently plan the campaign, able to efficiently ensure that every settlement is covered within that short period, and each of the children there are actually reached. There's also the air facility catchment mapping. Is a bit different from microplan, because air facility catchment mapping focuses on determining the kind of intervention a settlement is supposed to be assigned to. If a settlement is like 2 kilometers to an air facility in polio, it's supposed to be fixed session. That is required that people in those settlements are supposed to be able to walk to their facility. So you use the distance metrics to determine the number of settlements that are 2 kilometers to the air facility. And those ones that are 2 kilometers to the air facility are assigned fixed session. Those ones that are between 2 to 5 kilometers are assigned outreach, and the other as mobile. So with the GIS, you're able to do a distance metrics from that air facility, a real-time distance, road distance, not just a buffer. You use a road distance and you generate a service area. So that's like an air facility. So air facility catchment mapping. Those kind of mapping help to know what kind of intervention a settlement is supposed to be assigned to. It can be outreach session, it can be fixed, it can be a mobile session, it can be fixed post. So you're able to ensure that all the settlements are already planned for using our facility catchment. And there are other data kind of mapping platform we have. Of course, we have the DTS tracking. DTS itself is also like a data mapping platform that helps in tracking. And of course, all these have helped actually to provide a lot of help to the polio program. Thank you.
Thank you so much, Mr. Tosin, for that extensive, those extensive examples. And I'm sure that people listening also, I'm sure that at least there are 1, 2, 3, or more people who are intrigued by what you have just shared. The fact that based on digital mapping, we can determine what resources to allocate to different settlements, because on the map, you're able to see which settlements are closer or within walking distance to a health facility, the ones who are farthest from the health facility. And based on all of this, digital analysis, you were able to determine that this one needs, the settlement that is a walking distance from the clinic needs this, amount of resources. The one that is maybe 20, 30 kilometers away needs an outreach. The one that is, maybe 100 kilometers away needs something different. And this is the beauty of, GIS mapping and being able to, look at things from a spatial point of view. It definitely helps decision making. Thank you, Mr. Tosin, for sharing that. All right, so my next question goes to you, Mr. Dahiru. You have supervised field activities, for over 6 years, and you've supported the use of GIS in this endeavor. Can you also provide us some examples of, these impactful public health interventions?
So thank you. Like what Tosin mentioned regarding the catchment area, initially it was hand-drawn health facility catchment area maps. So that process also always used to leave out some settlements not captured in the hand-drawn map. So when we turn to using the GIS, we're able to capture all the settlements and know their distance geographically, their distance to the health facility. So we started by creating buffer, 2 kilometers buffer, to see who settlements falling within that range, who should go and receive the healthcare will work, because it's agreed that nobody should walk more than 2 kilometers to access healthcare. But even with that, we come to notice that, okay, on the map it's showing that it's 2 kilometers, but due to terrain, like it might be behind a hill or something else, so it takes more than 2 kilometers going around that place. So that's where the distance matrix come into play. We're able to determine which intervention suits which community and which settlements. Anything above 2 to 5 kilometers is outreach, where the healthcare facility personnel fix a day or two in a week to go to that to that settlement and provide all the necessary services required. And anything above 5 to 10, it's a mobile, where they use their bikes and cars to go with all the services rendered in the health facility to the community, so that to make sure even the underserved remote communities access healthcare with ease. So that's parts of the interventions we are doing. Okay.
All right. Thank you very much, Mr. Dahiru. Please, if you have questions, kindly use the Q&A box. I'm already seeing some interesting questions, and I'm looking forward to the question and answer segment. So please, if you have your questions, please put them in the Q&A box, and we'll take your questions before we come to an end. All right. So the next question is for Mr. Mark Levy. So Mark, do you think communities, government agencies are fully embracing the use of digital mapping solutions for health interventions? You've worked in Democratic Republic of Congo, you're also working in Nigeria. From your experience, do you think communities, especially government agencies, are fully embracing the use of digital mapping solutions for health interventions?
The short answer is no. The slightly longer answer is along the lines of what I said in my earlier response to one of your questions. I think they do universally see the value of incorporating spatial solutions into their work, but it's not yet fully reflected in the full organization of their standard operating procedures, their requirements, their training, their supervision. It's not reflected in the standards for the data that they use in reporting and surveillance and monitoring and so on. And so we still, even at the end of 2024, we still encounter cases where a local government health team will be using a set of settlement names or facility names that don't match any other data in the country. And that makes it, almost impossible to map those places because there's very time-consuming work that has to take place to identify the relationship between the non-standard names and the standard names. So I think we're at a stage where there's enough embrace to start moving forward much more rapidly and completely but there's not enough embrace to say that it's already at that level. Thank you.
All right. Thank you very much, Mark. I think it's rightly so. And this is why we have conversations like this. With the hopes that key stakeholders, decision makers, will come across these conversations and be inspired to embrace this technology for improved healthcare interventions. The next question is for Mr. Tosin and Dahiru. So I'll put this question to both of you. So briefly, what are the key factors to consider when creating digital maps for healthcare access in remote areas? So I'd like Mr. Tosin to go first, then Mr. Dahiru. What are the key factors to consider when creating digital maps for healthcare access in remote areas?
Yeah, let me just mention 2 or 3. The first one I will talk about is data quality, data availability. When considering data maps in remote areas, a lot of times we do not have data to even produce those maps. The data that is available is not accurate, is wrong, is very old, is not current. So we first need to ensure the good data, quality data, current data, reliable data. And is that data available? So that means you need to look at data collection methods and all those stuff. So those are the things we first think about. Once we know that this is what we want to do, look at the data that is required for that. Is it available? If it's not, then you need to collect those data and we ensure that the data is current and is accurate. The other thing is the technology selection or the tools to be used for data mapping in remote areas. Some of them do not have access to maybe internet, or there are some tools that may not work. If you're looking at web kind of tool, they may not be able to use that, but there are some other tools that can help. So you need to look at the technology to use, the tool to use. Maybe you're using an ODK for data collection, and so that is also required. So you need to know which kind of technology to put out there for in those remote areas. Then of course, because it's a remote area, there's a need for capacity building. They don't know what you're talking about. So we need to actually train them to be able to help you in providing that information. And of course, you can't do data mapping without the environment, without knowing the location. So there's a lot of involvement, community involvement too. You want to do data mapping in rural areas, you need community involvement. You can't do mapping without going there actually. So you need a lot of community involvement. The community must be involved in what you are doing. And of course, that means you need a lot of capacity building. The information, they have the information about those location at the back of your hand. So you need to get it from them, and you need to also train them to be able to use the tool you are designing for them. I think I will leave the floor to Dairo to speak on the words. Thank you.
Thank you. Yeah. All right. So Mr. Dahiru, over to you.
Thank you. In addition to what Tosin mentioned, also you need data on the terrain, the road networks, the accessibility status of the areas and the point of interest. You need to triangulate all this to know how they can easily get access to healthcare before even going to creating the digital map. So I think that's what you need mostly. And also information regarding the health facilities that are within the area. All that needs to be put in place.
All right. Thank you very much. So, I mean, a few of the things mentioned, important things that must be accounted for when creating digital maps: data quality, data availability, tools for data mapping, in remote areas, community involvement, information around health facility or infrastructure within that a remote area. Thank you very much, Mr. Tosi and Dahiru. All right, so I have one question. And just before I ask this question, for everyone listening to us, we are discussing connecting communities to healthcare with digital mapping. If you have any question, please put your question in the chat box and we will take your question. All right, so the next question is for Mark Levy. So, Mr. Mark, how can we ensure that digital mapping solutions are accessible and usable for local healthcare providers in remote communities? How can we ensure that digital mapping solutions are accessible?
That's a very good question. It's not an easy one to answer. In some ways, there was more work on this question a generation ago. There used to be a lot of effort in finding creative ways to get digital technologies to very remote areas using, transmitting data over radio waves or using weather satellites. A lot of interesting things. And then the mobile phone revolution happened, and people kind of took for granted that they could handle these mobile data needs much more easily. And as a result, the very remote communities have been neglected over the last 20 years or so. As I said, that's not an easy question to answer. Some of the things that I think are emerging as best practice is to diversify the technologies. So you would never want to build a spatial data solution that can only work on a advanced smartphone with continual data connectivity. And so that means building in use of paper maps, putting effort into the paper maps so that they can do as much as possible, printing them on paper that can be drawn on and erased with dry erase markers, training people in use of the paper maps, putting useful base maps and legends that make it easy to calculate distances, even if you don't have digital technologies for that. And there's recent experimentation with custom-made devices. Some of them have been used in Nigeria recently, which make it possible to do a lot of things that we used to be doing with smartphones, like tracking vaccinators and having vaccination teams enter survey data in the phone. Now there are these very small devices where the battery can last for several weeks. They're not a target for theft. They build in procedures for uploading data when they're in data connection, but still continuing to function when they lack it. So I think it's an area where we need even more innovation, but there are some things that we can try harder to do with the technology we currently have. Thank you.
All right. Thank you very much, Mark, for sharing that. And just like you said, it's not the easiest question to answer. And I think that when there are challenges, challenges inspire people to be innovative, right? And so because of this conversation and because of the people listening, do you want to help highlight some more limitations that exist around the use of GIS in this context? I'm hoping that people who hear some of these limitations can be inspired to think around ideas around possible solutions. So do you mind, as a follow-up, sharing what are some other limitations around the use of GIS for healthcare, especially in sub-Saharan Africa?
Was that directed at me? I'm sorry, I wasn't clear.
Yeah, oh, yes.
Well, sometimes there are limitations that are a function of the way data are collected. It's another case where, in the same way we got spoiled by the emergence of smartphones, in some ways we're spoiled by the availability of, globally covered, fairly high resolution satellite imagery, and then the derived products. Google and Microsoft are both making available at no cost their building footprint data. We, eHealth, and everyone else is exploiting that to a great degree in incorporating that information into spatial data solutions for healthcare. But there are some communities that can't be seen very effectively from those satellites. And so there's the danger that reliance on those data sources might be systematically biasing the responses, the plans away from those communities. We've seen some of this in the polio work we're supporting in the Democratic Republic of Congo, where in tracking through the origins of some of the recent polio outbreaks, it was determined that there were communities that were living along riverbeds and lake shores, often in areas under tree cover or vegetative cover of some sort, often living in structures that are hard to delineate from satellites, and often moving around. So they're not leaving a really strong footprint that can be seen from space in these data sets. And so many of these communities were left out of our original settlement maps. And we had to resort to extra efforts, even higher resolution data, greater level of field work, to start putting those places on the map. So that's one thing I would point to, and it calls again for diversification. Don't rely too much on a narrow set of instruments, or you might be leaving some communities out.
All right. Thank you very much, Mark. I'll be going to the Q&A session now. We have quite a number of questions. And so what I'm going to do is that there's a question from Habib, right? I'm going to direct that question to you, Mark, but I'd like you to, what you call it now, because to think around it and not respond immediately while I go to Mr. Tosin. So this is the question I want you to answer, Mark. So someone is asking this Chibuike, he's saying he works with an organization that educates adolescents in Nigeria around HIV awareness, mental health, sexual and reproductive health. So what benefits do you think GIS, integration will have for such an organization? So this person, okay, the question is from Habib. He works with an organization that educates adolescents in Nigeria on sexual and reproductive health rights, HIV awareness, mental health. What benefits does GIS integration have for such an organization? So I'm going to come back to get that answer. But right now, this question, I'm putting it to Mr. Tosin. So this person is asking, are there other metrics used to, or other tools used to complement GIS devices? So this person is asking, when we go to locations to, for vaccinations, so the GIS tool can tell the location that the vaccinators are at, but does the GIS tool also, detect what child has been vaccinated? So in a situation where a location is visited, but the actual vaccination did not take place, are there any tools to complement our GIS system to determine, that kind of situation? So this is for you, Mr. Tosin.
I think I can take that.
Oh, okay. Okay, great.
So, as you mentioned earlier, the tracking can't tell you whether a child has been vaccinated or not. Yes, that is right. So basically, you have a lot of what do I call it? Activities on ground that checkmate all this. We have the independent monitoring. There is in process and out process. In process is they used to monitor what the teams are doing during the campaign. They go house to house behind the team, asking what transpired in the house, checking the house marking, whether the team have written, whether they have vaccinated 3 children, and they will go inside the household and ask the parents, how many children do you have, were they vaccinated? And they will correspond with what the team reported. And there's end process that after the campaign, they go still up around the settlement and ask in houses and compare what the team reported versus what they saw on the house marking and what it's in the household. Also, there's another one, LQS, loss quality assurance sampling. This happens a week after the campaign, where independent monitors are sent to the field to go and access sample houses, 60 houses, to sample how many children were seen finger marked and whether they are truly vaccinated or no. So this also brings us to the current problem we are having with the teams. Now the teams and the caregivers are colliding to hide this non-compliance. When the team entire household, the parents and caregivers will tell them, please don't vaccinate my child. I don't want to collect the vaccines. And the caregivers will beg them to just, the team will beg them to just put a mark on the children that it has been done. And vice versa. Sometimes the team will support that and caregiver will agree to that. So all these errors, but we also introduce another one, APK such as who also goes hand to hand. They work together with the team. They enter inside the household, filling a different ODK. The teams are not, they don't even know what the ODK questions are. The APK searches used to fill all that and send to the server. So when they see a vaccination, a fake finger marking, they report it and it's like listed and action is taken in that regard. I think that answers the question. Thank you.
Yes, that's great. Thank you very much. So I would implore our panelists to help keep our answers as short as possible so we can take as much questions as possible. So Mr. Levy, so could you please answer quickly the question? So how do we integrate GIS, or what benefits can GIS integration have for an organization that deals with HIV awareness, mental health, sexual reproductive health rights, and stuff like that?
Yeah, it's a great question. GIS is useful whenever there's a variation across space in some important thing related to your work. So if there are risk factors that vary significantly across space, that can be useful. I know there are examples of people using mapping HIV vectors, trucking routes, truck stops, mining communities, and targeting interventions in those locations. For mental health, there could be some creative ways to do the same kind of thing. There are some risk factors for mental health problems that vary across space. Food security problems, political security problems might help target interventions. Awareness itself varies, and this can be mapped using household surveys, and that can also help you target your own interventions. And then finally, there could be creative ways to use spatial information to help connect people in need of services with places that can provide those services. Data Science Nigeria has been experimenting with tools that over SMS can identify needs on the part of particular people and then immediately direct them to the nearest facility that's able to provide those needs. And I'd imagine you might be able to do something similar around mental health needs. Thank you.
All right. Thank you very much for that on-point answer. All right. So this next question for you, Mr. Tosin. So this person is asking, for organizations that are looking to adopt and integrate spatial mapping into their programming, what steps should they take to achieve this?
Organizations looking to adopt spatial mapping, right?
Yes, into their programming. What steps should they?
So I think the first thing is that
it can provide those services. Data Science Nigeria has been experimenting with tools that are.
Okay, the first thing is that you need to, of course, identify the purpose, the project you are trying to, the purpose you are trying to solve, what you are trying to do. Once we know the project you are trying to implement, we need to know the scope of the project, the scope of the work. Then once we know the scope of that work, then we know the kind of data that's going to require, of course, because the project, that's the solution, the problem you're trying to solve, which is the project you're trying to, the project, you know the scope of the project, you know the data that is required. Once you know the data that is required, and you need to find out how do you get the data, is it from imagery, from the field, from other available data, then of course, the technology that you're going to use, is it proprietary, is it open source, is it, so the technology to use, if once we have the tech to use, then you can know the resources that are required to implement those technology. So of course, the first thing is that we need to be sure of what problem you are trying to solve, what question are you trying to answer, you know, what question, what project is it all about, and what's the scope? Once we know the scope, then we know the data, that if the scope is just within a local government, within a state, then you know the kind of data that you need. Once you have that data, you know the data, then the technology to use, then of course, the resource, you know, GI is all about people, and it's people that are going to use the technology. So they can now bring in the people together to people that are going to use the system. Once you have that, then of course, you need to now have the procedure, you know, the method, because there is both technology, people, methods. And of course, so you now have the people, then the method. So all these things makes up the GI system. So it's not just say you want to do a map or create a GIS, but you need to know all this, the problem you're trying to solve, the scope of the problem, the data required, the technology, the people, then the method, the procedures. And once that is brought together, you're able to have a GIS system. And of course, you have a way to regularly refine and update and everything. So that is like a summary of what creating a GIS system is all about. Thank you.
Oh, sorry, I was muted. Okay, so I want to quickly sneak in one or two questions because we have quite a lot. And anyone on the panel who is up to this should just unmute their mic and respond. So have there been any successful cases of using digital mapping in conflict zones? Just a quick answer from anyone on the panel.
That's definitely for e-health.
Yes, in conflict zone, yes. We've done that in Borno. In there's a program, the intervention called Reaching Inaccessible Children. That program, that intervention is in collaboration with the military. So it's the military that goes out to conduct the vaccination, but what we do as a team is to provide them the information, the data, the maps, and the information for them to go. We direct them, we show them the settlements that are being targeted. So it's kind of micro-planning for them. So they now go to those locations during their military operation. So it's not that the intention is just to go and vaccinate. They do the vaccination along with their own military operation because they have children in those places that are going to do those military operations. So we provide the maps and the vaccine. They go with the vaccine so that when they find children in those places, they vaccinated. So is in collaboration with their own activity. And so it has actually helped to ensure some of those places that could not be accessed by civilians are being accessed by the military, and children there are being vaccinated because we provide the information, the data that they need to conduct those activities. Thank you.
All right. Thank you very much. We just have, quite a number of questions just pouring in. I'm tempted to take maybe one or two more. So before we call it a day. So for Mark, there's a question quickly. This person is asking Ojumachika. This person is a data analyst, currently a GIS intern. And this person wants to know how GIS mapping is used to measure the long-term impact of public health interventions, and what indicators are used to track success of these campaigns? Are you able to provide a bit of a response to that?
We're finding it hard just to measure the short-term impacts. The needs tend to be so high that the pressure is enormous to devote effort to simply supplying people with the spatial data, information, and tools they need. There have been successful efforts to measure the short-term impacts. The long-term impacts tend to be, confounded by many other factors that relate to healthcare, food security, employment, political conditions, and over the long term, the interaction between those factors and the way spatial data is used tends to make it harder to isolate the impact. I think we need some more creative attention to this question. It's important. I wish I had a better answer for you, but it's something we're still working on.
Yes. Okay. So I'd like to make a quick request to Mark and all the panelists. If there are resources where the audience can go to learn more about GIS, because I see questions around how can GIS be integrated into tracking disease outbreak and surveillance. There are people trying to find out what are the most commonly used softwares in healthcare, digital mapping, and other things like that. I think people will benefit from some maybe online resources, so that after the this webinar, they can go and read up. So please, if you have any resources, you can please share on the chat box, so that people in the audience can copy them and then go and read a thing or two immediately after, while I just do some announcements here. So I want to say a big thank you for everyone that has been with us so far. I'd like to announce that eHealth Africa is going to be at the Global Digital Health Forum taking place in Nairobi, Kenya from December 4th to 6th, 2024. So if you are on this webinar and you'll be at the GDHF, the Global Digital Health Forum, we would like to interact with you, have conversations around, digital health solutions and possible partnerships. So we will be having a breakout session on the 4th of December in Kenya. And the theme of our breakout session is Staying Below the Radar: Innovation, Partnerships, and Technology for Health Impact in Nigeria. We'll also have some of our staff featured in some other side sessions. And so we really look forward to seeing you, engaging with you, having conversations. Our senior management team will be on ground, the executive director, directors of partnerships, global health informatics. So, I mean, we have a robust team that will be on ground in Kenya. And so we look forward to receiving you at our breakout session, and we look forward to engaging with you. I want to say a big thank you to Mark Levy for being on this call at this time. Thank you, Mr. Tosin, for sharing your experiences with us. Thank you, Mr. Dahiru, for also sharing your ideas and thoughts with us. This will bring us to the end of this webinar. Thank you very much for tuning in. It's been nice sharing with you. Please look at the chat box. There are some links there you can copy to learn more about GIS, about how it's integrated or how it can be integrated into what you do. GIS can be integrated into public health, into business, into agriculture, and just many other aspects of life. So thank you very, very much, everyone. Thank you again, our panelists. We really appreciate you. It's been a wonderful conversation. Have a wonderful day.
Thank you for having us.
Thank you.
Thank you, everyone.